Good afternoon, everyone. I'm Becky Whittish, Chairman of the Niagara County Legislature. Thank you for joining us again live on LCTV as we give you our Niagara County COVID-19 updates. We are also currently streaming live on lctv.net and on 90.9 FM on your radio. Now, today is day 100 since the first coronavirus case was reported in New York State. Joined today by our Director of the Niagara County Health Department, Dan Stapleton. Welcome, Dan.
Thanks, Becky.
And we were just saying, for some of us, in some ways, it's like this has been going on forever, and in other ways it's like the blink of an eye with as much as we've had going on. 100 days to think back where we were just a few months ago. Things are really trending for us in the right direction now, as we're about to talk about. So Dan, thank you so much for joining us again, and if you could just go ahead and start with our updates for the day.
Sure. Thanks for having me. So far we're at 27 new cases since Friday, 1,150 positive cases since the crisis began. We're at 226 active cases. Those are people who are positive, who are following. All but 12 of those are home. The other 12 are in the hospitals right now that we're following. The number of recovered grows every single day, 50, 60 at a time. We have 849 people who have recovered so far from the diagnosis, and thankfully we have no new deaths to report today since Friday. So that's tremendous news. That's positive news, and we're really happy to be able to report that.
That is good. And our Niagara County heat map, of course, has been updated again to show those new numbers. You can find that at niagaracounty.com at the top of the page in the COVID-19 banner. Again, this map breaks down the positive cases we've had to date by municipality, so you can see what's happening throughout our county. Switching to testing, I can tell you according to state data that we have now had 18,348 Niagara County residents tested for COVID-19, which is a great number. Again, testing really has ramped up here over the last month or so. So far from the frustration we were seeing at the beginning of this pandemic when it was so difficult to get testing here in the county. We can find that link for the state tracker on our Niagara County webpage as well. And that state tracker does break down county by county for you and show the statistics so you can see where we stand as opposed to the rest of the state counties. I also want to continue encouraging people, of course, to go out and get tested for COVID-19, especially as we're opening more things back up. More people are going back to work. We're having more contact as we're doing things like outdoor dining now. It really is very important to keep these testing numbers up and keep watching our rates and make sure that things aren't spiking back up again. So certainly you can see the list on your screen. We'll show you the list of the available testing sites that are in Niagara County. Again, we ask you to please call those phone numbers before going to the testing site because they do require you to pre-register. Some have requirements about prescriptions from your doctor and other things that you need to take care of before you go there. So call, get yourself an appointment. Most people can get tested free and easily in just a few minutes at this point. So please continue to do that. Now, Dan, we've been talking more and more, of course, about the percentage of our positive test results coming back. Essentially, the infection rate is what we're talking about here of those who are being tested. And that has been falling in Niagara County consistently for some time now. We do have a graph we can put up on the screen to show you of our rates that have been happening recently. Last week when you were here with us, we were at a 7.5% infection rate, and that's actually down to 6.1% now, and that's, of course, from the beginning of the pandemic to now. Our daily rates are much, much lower even. You'll see at the end of the graph there that we have many days that were under 2% coming back positive. We've had days that have been as low as 0.5% for the infection rate, which is wonderful news. What do you take from that? What does that tell us?
Well, it's something we've known all along. Anecdotally, we know that the numbers are continuing to go down. When we're looking at 6.1%, we're looking at a month and a half ago, we were 20%. We continue to be less than half of what the rate is for the rest of the state outside of New York City. So great numbers, something we're really happy about. It shows that what the public has been doing has worked. Mm-hmm. It shows the work that the healthcare workers have been doing has worked. Our first responders, and so on. So all these people, everybody, the public working together, make sure we socially distance, we wear masks, we stay 6 feet away. Those types of things are why this is happening. No other reason why. It's because people are doing what they need to do. And I want to make sure that all the risk that the healthcare workers and the first responders, all the work that my staff, your staff did, that it doesn't go to waste. By that I mean continue to use the things that we know. Wash your hands more often. Use hand sanitizer, wear a mask, be 6 feet away. All those things that we all know now, we can repeat those in our sleep. We need to continue to do that so we don't don't go to waste, those efforts. But also, I know a lot of people are saying, well, what happened to Memorial Day? How did that impact us? Right now, based on the numbers, we're not showing any impact from the Memorial Day weekend in terms of people abusing those rules we give them. But we still can continue to get the results of testing for Memorial Day weekend. But right now, at this time, it looks really good. So once again, we tell people, make sure you clean your hands, you sanitize your hands, you 6 feet away, you wear a mask. Those are the things that are protecting all of us, and let's continue to do that so we can continue to be a success story for all of New York State.
Very good. And so we know the other metric that we look at very closely is the hospitalization rates. And the whole idea was to not overwhelm our hospitals and the hospital staff as we went through this pandemic. So you can see the graph up on your screen now. It shows our hospitalization rates over time. And this is good news that we've had these decreases in the positive cases. But why does this curve move so slowly downward on the other side?
Well, that's consistent with what pandemics do. There's usually a very rapid increase in the rate of infection. The people who are most at risk, the people who are sicker, they're the people who are most impacted. So that's why you get a lot of people who are at risk die, unfortunately, or get very sick. So that's consistent with pandemics. Pandemics, you also will see a more gradual slowdown of the descent, if you will. Then that's typical with pandemics. People don't always realize this is a real world thing. This pandemic, it's something that usually doesn't happen very often. So we're learning about it still to this day, but we do know that that's typically what happens. When I look at the curve of our infection rate in Niagara and how rapidly it's decreasing, when I look at the number of people positive, people talk about flattening the curve. We've pushed that down even more than the state has done it. I'm very proud of the work that everybody did because these numbers decreased at a lower rate or increased at a lower rate, and they also are decreasing fairly rapidly. So we're very happy about that, but we need to keep up the vigilance so that we don't lose all the positives that we've gained by just doing the right thing.
That's right. Our metrics are certainly trending in the right direction, as you said. We watch those very closely, especially in the regional control room that I'm in, as we talk about the different phases of reopening. But we're not done. The pandemic's not over, correct? I mean, we haven't seen a vaccine come out just yet. So what would you say about that? What do people need to look for and wait for?
And people get tired of hearing it from me. They but the fact is, do those things that we talk about. I don't see a vaccine coming out from the experts until sometime maybe in January. People who remember about 10 or 11 years ago when we had H1N1, we had a vaccine when that started. We were able to control it. Our focus was making sure people get vaccinated. This time we don't have that yet. Mitigation, controlling the spread is much, much harder than doing large vaccination clinics. We had vaccination clinics in very small fire halls. We would do over 400 people in an hour. When we know what we need to do, and that would be vaccination, we can do it really quickly. But this stuff, we're not there yet because we don't have the vaccination yet. So we're doing things to control the spread, which people are really responding positively to. And I know my staff and I, when we get the vaccine, our role will completely change to vaccinating people from that. But right now we're managing it differently than we might have with the last pandemic we had. So we're already prepared for the vaccination clinics. And as soon as the vaccinations become available, we'll control the spread through that. But until then, we need to keep up the vigilance that we've been following all along.
Wonderful. Well, thank you, Dan.
Sure.
Thank you, of course, for being here with us on a Monday to give us these updates. As Dan just said, our data is looking pretty good at this point, and the governor did reiterate that this morning. Seems why every day now he has a new tweak in his policies and new things that are allowed and new options that are opening up to us. So I'll just give you a few of those. For example, last week we were told by the governor that he would be allowing drive-through and drive-in graduations. Now we'll also be allowed to have outdoor graduation ceremonies of up to 150 people. Again, social distancing rules apply, 6 feet and masks, but up to 150 people in an outdoor setting for graduation ceremonies will now be allowed, which is good news for some of the schools as they try to plan moving forward later in June. Last week, church services for 10% of their building capacity has now been increased to 25% of their building capacity. So originally it was 10 people or fewer were allowed to get together in the churches, which obviously is not much of an option. It allowed smaller things like Bible studies or small prayer groups, but now 25% of the capacity of that church is allowed, which is wonderful news as well. Again, with strict guidelines in place for those churches to follow. Now, New York State begins taking reservations for all their camping sites this morning as well. That started at 9 o'clock today. That includes tents, trailers, RVs, yurts, and cottages. Reservations can be made for stays beginning on June 22nd. You will have to have a reservation to use these state campsites, so make sure that you're calling in advance, and that number is 1-800-456-CAMP. Or you can visit newyorkstateparks.reserveamerica.com. Online reservations are encouraged, and again, you want to make sure that you set that up in advance. I imagine that's going to be a very popular thing to do this summer with many other events being closed down. We also know that outdoor dining began last week. That was very obvious. If you were out and about, we saw many restaurants with their patios open and people waiting to be served. It was a wonderful thing to be out a little bit again and enjoy that experience with my family. We did that this weekend, and it was good to be out in the nice weather. On our call with local government leaders last week, my colleague Rich Andres, one of our other legislators, discussed how to help restaurants extend their footprints in order to accommodate more people and stay within the guidelines. We know that restaurants need to be able to serve a minimum number of people to make it financially worth it for them to be open. So we really are asking our local governments to waive certain zoning restrictions, help accommodate where they can, and really help these businesses get up and running. We're also holding another drive this week through the Niagara County Emergency Management Services Department. They're going to be giving out hand sanitizer and masks to local businesses, and that will be held out at the Niagara Falls High School. Information for that event can be found on our Niagara County Facebook page. You'll also find the link there for the form that you'd need to complete to receive those items. Go to facebook.com/Niagara County to find our Facebook page. And again, fill out that form if you're a business that's reopening. If you're having trouble getting sanitizer or masks, we can help you out with that. And again, I continue to remind everyone of our 24/7 free and confidential helpline. That's Crisis Services for Niagara County. The number is 716-285-3515. They're there all day for you. We know that this has been a difficult time. As I said, 100 days now we've been going through this process and really just living a life that none of us are used to, and that comes with many, many struggles and challenges. So if you are struggling, if you have a loved one, a family member that needs some extra assistance right now, make sure you reach out to them. Again, it's 716-285-3515. If you joined us late today, you can catch us on demand during the day. On LCTV, they'll replay us in their schedule as time allows, so we continue to thank them for that nice option. They'll also have a link under their on-demand page for the Niagara County Legislature. We'll also post that link, of course, on our Niagara County Facebook page for you to find easily as well. For now, everyone, I just want to encourage you to enjoy this nice weather. Go out and get yourself tested and make sure that you're not transmitting that disease into the community. And just more importantly than anything, stay safe and stay healthy.